My name is Tahir Pillay. I'm a professor of chemical pathology at the University of Pretoria.
So my name is Eric Bacchino and I come from Montpellier, a university city in south of France.
I'm Alfredo Eugene Walker. I'm a forensic pathologist from Canada.
Okay, my name is Dr. Robert Gabriel Ude. I'm a specialist, a forensic pathologist.
How do I know I had a love for bones?
Well, as such.
Okay, let's start.
It is the ASFM conference, which is the African Society of Forensic Medicine conference. And gathered here are some of the world's top forensic medical experts. Join us on this special journey to discover what it's like in their world.
Where we are going with forensic medicine to the next generation. We need to think carefully and to try to adapt this model, the stage of changing, to drive the mind of junior doctors from pre-contemplation to contemplation.
We've all seen shows like CSIR Miami and CSIR New York, where crimes are solved like this, and they have fancy schmancy equipment. But how does one practice forensic excellence in a resource-limited and resource-depleted environment?
Well, establishing the cause of death is the primary role of a forensic pathologist, and we use every tool available to us, including the autopsy, but the history, the information brought to us by law enforcement or other witness statements. I have death investigators who go to the scenes. I don't go to all the scenes, but I go to some of the scenes. And at the end of the day, I have to put together the history, the autopsy findings, special testing like toxicology and histology, and sometimes I find more about the case after the autopsy. It can be very challenging in a limited environment. If you are in a place where you don't have x-ray capability, or you don't have histology, or you can't do toxicology, that's extremely challenging, and that's really where the skills of the forensic pathologist are taken to their limits.
So it's an important question because most of the time the percentage of accurate cause of death that you will produce will depend on the resources. When you rely only on external examination, death certificate will be inaccurate in 60% of cases. When you perform a complete autopsy, you will reach 80-85%. And if you invest money in CT scan, toxicology, histology, DNA, you will reach maybe 95 to 96% of cases where the cause of death will be accurate. But the most precise you want to be, and the most expensive it is. So in a limited resource country, I think that you need good external examination and a good basic autopsy, because all the rest is very expensive. And for that, the solution is to get good training. So the solution to the lack of money is to get a good training. Training is also expensive. Supposingly, I was a good professor. If you want to send me to Africa or to North America, it will cost a lot of money. So I think the solution now, even if I don't support it, but we need internet teaching, online teaching. That's not the best solution, but it is the only solution to compensate this funding problem.
So I think that we'll look at the first world experience. The reality is, post-mortem examinations do not always give us the answer, and we have to accept that a detailed analysis doesn't provide us with certainty. When that happens, we have to be honest and say we don't know. our genetic testing has helped us in some cases of sudden death, where we know that there are some genetic abnormalities of heart rhythm. We can now at least, we may not formally provide a cause of death in the person who's in front of us, but we may be able to find a gene that would be associated with sudden death, and we can have the relatives checked out, and that, then I think we've done our job. And I think as you get older, you get more honest that we don't really have the answer. So the evidence is that more experienced forensic pathologists are more likely to say the cause of death is undetermined rather than the more inexperienced. Now, if you translate that to low resource, then the likelihood of you failing to provide a cause of death is going to go up. You may not have the ability to do toxicology. You may not have access to a histology laboratory, and some diagnoses are dependent upon that. But then it also comes down to what you're doing the forensic autopsy for, and different systems have different rates of performing autopsies. In Ontario, in Canada, our system does about 8.5% of all deaths as medical legal autopsies. So that means that, nearly just over 90% of cases do not get an autopsy. Some are investigated by the coroners. They investigate probably 25% of all deaths, because most deaths we know what the cause of death is. People die of cancer in their own homes and so on. Or they have a heart attack, they go to hospital and they don't recover and they die. But if you go to other legal systems, they only do the cases where they are concerned about criminality, and they really don't do much else. Or, is it a suicide versus is it a homicide? And so in those cases, you probably are going to have a higher rate of identifying a cause of death, because for most suicides outside of drug overdoses and most homicides occur with injuries that are obvious. They are back to my comment about these are autopsies of documentation. So if you are resource limited, then you're probably better targeting your autopsies to what is best for your criminal justice system and maybe your public health system, rather than trying to do sudden natural deaths that you are less likely to be able to find a specific and relevant cause of death.
So forensic pathology is all about the truth. We do not have agendas. We do not have narratives to spin. We do not work for any political party. All we care about as medical professionals who took the Hippocratic Oath is the truth. So what we find is what we find. No one may tamper with our reports. We will find what happened and we will report on the truth. Not your truth, not his truth, not her truth, the absolute scientific truth. And that is what makes forensics the ultimate discipline.
They tortured him by whipping, obviously handcuffing, then whipping, then pouring boiling water on him.
And emerge in the recreational drug market. They may be described as designer drugs, research chemicals, legal highs.
The study population included all the femicide cases that presented to the 3 medical legal mortuaries within the study period.
Today, we have gathered some of the world's top forensic medical experts. And I want to hear from them how forensic medicine and forensic pathology can help address some of these historical injustices, and how we as forensic experts can help address and solve some of the atrocities that have happened on our continent.
Well, historical injustices, of course, are things which have been there for very long, and many people are still there and they feel like they are not being solved. We have cases in many countries where there are mass graves, which people are buried after being killed by various governments, and people are crying for justice. So it can help because many jurisdictions have organized exhumations and finding the cause of death, and bringing perpetrators into books. So that's one of the areas which is forensic pathology can help.
First of all, there should be strong laws. The legal systems and the legal systems should be very strong. For us, forensic pathologists, I think to help with the question you've stated is that we should be working independently so that we stand in the way of justice or on the side of justice. In many African countries, sometimes you find a situation whereby a medical legal practitioner cannot work independently. It happened even here during the case, for example, of Steve Biko. If you remember, the doctors who did the post-mortem, the medical legal practitioners who examined the Steve Biko were not acting independently. So if you read the reports and the findings, you can see that, or you will see in many cases that, no, this is not the truth. The truth is being hidden somewhere, either because of fear or because of intimidation. So I think to strengthen is to strengthen the legal system, number one, but number two is to get in a position whereby medical legal practitioners can work independently.